Good evening, everyone. Good evening, everyone. So in today's class, we are going to discuss some questions from the past papers, right? So today, this is going to be a session on previous year's question. So let's start with the first question. Which of the following give rise to calcified tissue of teeth? So which of the following is going to form? Which of the following is going to form calcified tissue, right? Just a minute, there seems to be a problem with the tablet. Yes. So the first question is, which of the following will give rise to the calcified tissue of teeth? And the options are mesoderm and endoderm, ectoderm only, ectoderm and mesoderm, ectoderm and endoderm, right? So which of these will form the calcified tissue? So when you say calcified tissues, what it means is enamel, dentine and cementum. So dentine and enamel, these will be formed by the dental papilla, isn't it? And enamel would be formed by the enamel organ. So enamel organ is derived from ectoderm, isn't it? And the dental papilla, that is a mesodermal derivative, isn't it? Ectomesenchymal derivative or mesodermal derivative. So option 3, that is ectoderm and mesoderm, is your correct answer, right? So the correct answer to this question would be ectoderm and mesoderm. Now I have a couple of questions related to this question, right? Let's go to those questions. So which of the following structures is entirely ectodermal in origin? So based on that question or a variant of that question, right? So which of these structures is entirely ectodermal in origin? So they can ask you that, right? The tooth has 3 calcified structures or 3 calcified tissues, enamel, dentine and cementum, as I just told you. And of those, only one is of ectodermal origin and the other 2 are of ectomesenchymal or mesodermal, right? So which is the ectodermal? So options here are enamel, dentine, cementum and pulp. Obviously pulp is soft tissue, so it can be ruled out, but the other 3, dentine and cementum, these are mesenchymal in origin, and the enamel, that is ectodermal in origin, right? So the correct answer to this question would be enamel. So another question, which of the following is derived from dental papilla? Now the tissue can either be derived from enamel organ or from papilla, isn't it? So from enamel organ, what we have is enamel, isn't it? So what do we get from papilla? The answer would be very good. It is dentine and pulp. So both of you are correct, Prachi and SR, right? So the correct answer would be dentine and pulp. Cementum would be derived from follicle, right? It would be derived from dental follicle, isn't it? PDL also would be from dental follicle. Enamel is from enamel organ and dentine and pulp are from papilla, right? So let's go to the next question. So this was a picture based question, and here they have asked about the succedaneous tooth, right? So which of the permanent tooth is not a successor from the given OPG? So what do you mean by successor? A successor is a tooth, or a succedaneous tooth is a tooth that replaces a deciduous tooth, right? So this successor, what it means is that it replaces a primary tooth, isn't it? It replaces a primary tooth. So what are the options here? 5-4, 4-5, 1-6 and 4-2. So basically this is FDI notation system, isn't it? FDI notation system. यूनिवर्सल में ये नंबर्स नहीं मिलेंगे कभी भी, ना ही ये मिलेगा. यूनिवर्सल इज फ्रॉम 1 to 32 and for primaries it is alphabets, isn't it? So we can safely assume that this is the FDI notation, isn't it? And when you look at this OPG, you would realize that it indeed is the FDI notation. So 5-4, what it means is, it means that they are talking about the maxillary right primary first molar, isn't it? Maxillary right primary first molar, that is 5-4. 4-5 is the second premolar. 1-6 is the permanent first molar, and 4-2 would be lateral incisor. So this is the lateral incisor, this is the first permanent molar, and here this is the premolar, and this we have as the primary molar. So obviously the question is asking about the permanent tooth. So we can easily rule out option A. This can be ruled out. So from the three options, that is 2, 3 and 4, which is a non-successor. So which of these three does not succeed any primary tooth? So even if you don't have this picture, still you will be able to answer, isn't it? So 4-5 is a succedaneous tooth. Premolars are succedaneous, incisors are succedaneous, canines are succedaneous. But the permanent molars, they are non-succedaneous, isn't it? They do not succeed any primary tooth. They do not replace any primary tooth. So permanent molars, they do not replace any primary, isn't it? They do not replace any primary. So permanent molars are the only non-succedaneous teeth. So the correct answer here would be option 3, that is 1-6, isn't it? So 1-6 is visible here in this radiograph, and this here is the 4-5, isn't it? And this you have 1-6, then this is the 5-4. Clear? So you can easily visualize these teeth in the radiograph, and yet we don't need these. We need this radiograph. Even if we didn't have this radiograph, we could easily answer this question, isn't it? So when I got these questions, this word was missing from this question. Actually, I edited this question to add the word permanent. So let's assume that the question that you get in your exam is which of the following tooth is not a successor from the given OPG, right? Which of the tooth is not a successor from the given OPG? Let's say this word was missing from the question. Now we have the same options. What do you think would be the correct answer? What do you think would be the correct answer now? If we don't have the word permanent, or if we exclude the word permanent, which of these 4 would be the correct answer now? If we exclude the word permanent, does it change our answer? Does it change our answer if we omit the word permanent from the question? Now we still have the same options, isn't it? 5-4, 4-5, 1-6 and 4-2. And 1-6, as we have already established, it is non-successor tooth, isn't it? What about this 5-4? What about 5-4? The the primary first molar, or for that matter any primary tooth. Are they successors? Are they successors? Again, just like the permanent molars, they are not successors, right? They are not successors. They are primary teeth. They are not successors, isn't it? So option 1 and option 3 would be the correct answer. So if it is an exam where you can mark more than one options, then yes, you can go with option 1 and option 3. Other than that, there is a problem with the recalling of this question, right? So the word permanent has to be there, or option A has to be something else, or option 3 has to be something else, right? So don't get confused. So again, I have some similar questions, just variations of this question, right? So based on the concept of successors and that OPG that we just saw, right? So which of the following teeth have no predecessors in primary dentition? So it is the same question, but the language is changed, right? So which of the following teeth will have no predecessors in the primary dentition? So that is again the same thing. Which of the following is a non-successor tooth? Or which of the tooth will not replace any primary tooth, isn't it? So options are molars, premolars, canines and incisors. And as I just told you, which of these 4 would be a non-successor, or a tooth which does not succeed any primary, or which does not have a predecessor? Which will be the answer? Which of these will be the answer? It would be molar, isn't it? Prachi, SR, try to answer. These are just simple questions, isn't it? Just variations of the questions that we already have seen. So which permanent tooth replaces primary maxillary second molar? right? So here the question is asking about the permanent tooth which will replace primary maxillary second molar, isn't it? Primary maxillary, so primary maxillary second molar. So the tooth that is going to replace the primary maxillary second molar. So which tooth will it be? It will be maxillary second premolar, maxillary first premolar, maxillary canine, or maxillary second molar. Obviously, premolars replace the molars, and the second molar would be replaced by the second premolar, isn't it? So option A is the correct answer here, right? So let's go to the third question. In hypocalcified enamel structure and its consistency are described as. Now this is a question from oral pathology, but since I got it, I thought why not, right? So let's discuss it. In hypocalcified enamel structure and its consistency are described as. So now there are two terms, isn't it? One is hypocalcification and the other one is hypoplastic, right? So what is the difference between hypocalcification and hypoplastic? So when you say hypoplastic, it implies a defect in the secretory stage of amelogenesis, right? It implies a secretory defect in the amelogenesis. On the other hand, the defect in the hypocalcification is in the maturation stage, isn't it? So the stage that is defective is different in both of these, right? In hypoplastic, it's the secretory stage that is defective, and in the hypocalcification, it is the maturation stage. So since the maturation stage is defective, but the secretory stage is normal in hypocalcification, and we are concerned here with hypocalcification. So since the secretory stage is normal, the amount of organic matrix or the enamel matrix that forms initially, isn't it? The enamel matrix forms initially, though it is calcified immediately, yet it forms. It's a different matter that we are not able to see it, but it does form, isn't it? Enamel proteins are secreted, they get calcified, right? So the entire thickness of the enamel will be formed, and hence we can safely say that the enamel structure would appear normal. That is, its thickness would be normal, isn't it? Its thickness would be normal, but it does not get properly calcified. And since it is not properly calcified, do you think it will be soft? It will be brittle, isn't it? It won't be hard. It would be brittle. It would be soft. So option 2, that is normal and brittle, is the correct answer, as you have said, right? Prachi, option 2, very good. Hansika, it's not option A, it's option B, right? It won't be normal and hard. Since it is hypocalcified, it has to be soft, right? So again, I have two similar questions or variations of the question that we just discussed. So hypoplastic enamel differs from hypocalcified enamel in that, I think we already just discussed it, right? The difference between hypocalcification and hypoplasia. So hypoplastic enamel differs from hypocalcified enamel in that, so quantity is reduced but hardness is normal. Quantity is normal but hardness is reduced. Both quantity and hardness are reduced, and both quantity and hardness are normal. So hypoplastic enamel differs from hypocalcified enamel in that. So first thing is that we need to understand the question, that it is asking about the hypoplasia. So we have to talk about hypoplasia. What happens in hypoplasia as compared to hypocalcification, right? So hypoplasia differs from hypocalcification in that in hypoplasia the quantity is reduced, isn't it? In hypoplasia the quantity is reduced but hardness is normal, because the secretory stage is defective but the maturation stage is normal. So in hypoplasia secretory stage is defective, isn't it? Secretory stage is defective, but maturation, that is normal, isn't it? So whatever amount of enamel is formed, that would calcify normally, isn't it? So that would have normal hardness, though the enamel itself will appear deficient. Why? Because there is a defect in secretory stage. So less amount of enamel is formed. Is it clear? So it's not the option B, it is the option A, that is quantity is reduced but hardness is normal. Hypoplasia differs from hypocalcification in that, so we need to talk about hypoplasia, not hypocalcification, right? We need to find a point that differentiates hypoplasia from hypocalcification. Is it clear? तो कभी कभी ऐसा होगा कि इस तरीके के क्वेश्चंस हमें कंफ्यूज कर देते हैं, राइट? You might be thinking correct, or your answer might be correct based on what you are thinking, right? So maybe SR and Prachi are thinking that they need to talk about hypocalcification where the quantity is normal but the hardness is reduced. But in fact, the question is talking about hypoplasia. Since the language is a bit confusing, we need to focus on the language. We need to understand what the question is trying to ask, right? So here the question is asking about hypoplasia and not hypocalcification. So sometimes we get such confusing questions. तो आराम से पढ़ो, धीरे धीरे पढ़ो, उसको समझो कि वो क्या कह रहा है. हाइपोप्लेजिया हाइपोकैल्सिफिकेशन से किस तरीके से अलग है, right? So maybe you can translate it in Hindi or do some other trick and try to understand it, right? तो हाइपोकैल्सिफिकेशन से हाइपोप्लेजिया किस तरीके से अलग हुआ? क्योंकि हाइपोप्लेजिया के अंदर अमाउंट कम हो जाता है बट जो भी बना वो नॉर्मल हार्डनेस का बनेगा. इज इट क्लियर? सो विच अमीबा स्टेज इज मोस्ट अफेक्टेड इन हाइपोकैल्सिफिकेशन? तो हाइपोकैल्सिफिकेशन में कौन सी स्टेज अफेक्ट होगी? अभी अभी हमने डिस्कस किया, राइट? वी जस्ट डिस्कस्ड इट. विच स्टेज इज अफेक्टेड इन हाइपोप्लेजिया, विच स्टेज इज अफेक्टेड इन हाइपोकैल्सिफिकेशन. So in hypocalcification, the stage that would be affected is maturation, isn't it? And in hypoplasia, the stage that is affected is secretory, right? So this is hypoplasia. So I'm just writing plasia, right? And this is in calcification, isn't it? Maturation. So option C is the correct answer for the 6th question. Is it clear? क्या कोई डाउट तो नहीं है? देखो, हमेशा क्वेश्चन को पहले अच्छे से समझने की कोशिश करो, राइट? क्योंकि क्वेश्चन समझ में आ गया तो आंसर्स अपने आप आसान हो जाएंगे. अगर क्वेश्चन नहीं समझ में आया तो इजी क्वेश्चन भी डिफिकल्ट हो जाएगा, राइट? तो हमेशा क्वेश्चन को पहले आप प्रॉपर टाइम दो, उसको ढंग से समझो. सो लेट्स गो टू दिस 4th क्वेश्चन. व्हिच ऑफ द फॉलोइंग हेल्प्स इन रूट फॉर्मेशन एंड डिटरमाइंस इट्स शेप? सो रूट फॉर्मेशन एंड द शेप ऑफ द रूट, नॉट ऑफ द क्राउन, right? So formation and shape of the root. So dental papilla, dental follicle, HERS and stratum intermedium. So which of these 4 do you think shapes the root or forms the root? Is it papilla, is it follicle, is it HERS, is it stratum intermedium? And very good, Hansika, it is HERS, right? Hertwig's epithelial root sheet, right? Hertwig's epithelial root sheet, isn't it? Hertwig's epithelial root sheet. And what is it made up of? What is it made up of? It is made up of inner enamel epithelial cells and outer enamel epithelial cells. So once the crown formation is complete, right? Once the crown formation is complete, let's say this is the crown and the formation has just been completed. Let's say this red line here indicates the inner enamel epithelium and this black line here indicates the outer enamel epithelium, right? So as you can see, a loop is forming here, isn't it? A loop is forming here. A loop is forming here. So this loop, this structure, it consists of inner and outer enamel epithelium. Obviously, stratum intermedium and stellate reticulum cells, they are all here, but they are not a part of this cervical loop. This is known as cervical loop. So this is the stratum intermedium and the stellate reticulum, they are not a part of cervical loop, and the cervical loop extends downwards to form the HERS. It extends towards the apex, right? So again, I have a couple of questions. So Hertwig's epithelial root sheath is derived from. So I guess we already discussed the answer to this question, isn't it? Inner and outer enamel epithelium, dental papilla, stellate reticulum, and stratum intermedium. So which of these 4 do you think is the correct answer? We just discussed it, right? Herpes epithelial root sheath is derived from, it is derived from inner and outer enamel epithelium, isn't it? Yes, very good. And the next question is, which of the following is responsible for formation of lateral or accessory canals? So, how are the lateral or accessory canals formed? Options are break in HERS, fusion of cementum and dentine, persistence of dental lamina, and failure of stratum intermedium. So, which of these four do you think is the correct answer? Is it break in HERS? Is it fusion of cementum and dentine? Is it persistence of dental lamina, or is it failure of stratum intermedium? Yes, very good, Ansika. Again, the correct answer here is option A, that is break in HERS. So, can you tell me the difference between accessory and lateral canals? What is the difference between accessory and lateral canals? Let's say this is your normal pulp canal, isn't it? This is your normal pulp canal. Now, what is an accessory canal? Now, what is an accessory canal and what is a lateral canal? Let's say a canal is originating from this pulp canal, right? At some angle. Now these canals, they are not parallel, isn't it? Are they? These canals, they are not parallel, or you can say they are not in the general direction of this pulp canal. So therefore they are known as lateral canals. Now just imagine what happens when there is an additional canal which is running parallel to this particular canal. Let's say now we have let's say this is another pulp chamber and canal, and we have these small canals which are more or less parallel to your main pulp canals, right? So these would be accessory canals. Is it clear? So accessory canals, they follow the same direction as your main pulp canal, and the lateral canals are those that originate at an angle, right? So usually they are seen at the apical third. So you would have heard of the term apical delta, right? You might have heard this term apical delta. Now as you can see here, because of the formation of this lateral canal, a triangular piece of dentine would be seen here, isn't it? A triangular piece of dentine would be seen here, and that is what a delta looks like, a triangular piece of land, isn't it? So this piece of dentine here between the two canals is known as apical delta. Is it clear? So apical delta is found usually at the apex of the root, and it occurs due to presence of the lateral canals. So these lateral canals, they are more numerous in the permanent dentition. These lateral canals, they are more numerous in permanent dentition, whereas the accessory canals, they are more numerous in primary dentition, right? The sum of accessory and lateral canals, now lateral canals individually, they are more in permanent, accessory canals individually, they are more in primary, but the sum of accessory and lateral, that is more in primary, right? So accessory plus lateral more in primary, lateral alone more in permanent, and accessory alone more in primary. The branch that extends from the main root canal, tiny branches that, yes, tiny branch, all these extend from the main root canal, right? All these accessory beat, lateral, they extend from the main root canal only, or the pulp chamber, right? So which of the following is not derived from dental follicle? So in the first question we talked about, or maybe in the second question, I guess, or maybe in the first question, we talked about the derivative of ectoderm and mesoderm, right? So here the question is asking about the derivative of dental follicle. So as I have told you in the first question, we have enamel organ, then papilla, and then follicle, isn't it? So which of these three is not derived from dental follicle? Dental pulp, cementum, PDL, alveolar bone. So obviously the correct answer, as all of you have said, is dental pulp, isn't it? So always remember that follicle, it forms the periodontium, right? It forms the periodontium. Enamel organ forms enamel. So the remaining tissue, that is dentine and pulp, that is formed by the papilla, right? Option D. Alveolar bone also is a part of periodontium, so that would also be formed from dental follicle, right? So here we have a variation in the options in the first question, right? So which of the following does not arise from dental follicle? Which of the following does not arise from dental follicle? This is the same question that we have just discussed, just that the options are different here, isn't it? The options are different. So what are the options here? Periodontal ligament, cementoblast, alveolar bone, and dentine. So which of the following is not derived from dental follicle? Which of the following does not form from dental follicle? Yes, very good, Aarti. It is the dentine which will not form from dental follicle. Now here, instead of cementum, it says cementoblasts. So does it change anything? Doesn't change anything. Instead of cementum, I have mentioned cementoblasts. Does it change anything? And the answer would be it does not, because even the cementoblasts, they are derived from the dental follicular cells, and once the cementoblasts are derived from those cells, then the cementum would be secreted, isn't it? So yes, the cementoblasts arise from dental follicle and then the cementum is formed, right? So sometimes they may confuse you with these with such options. So cementum is formed by cells differentiated from, again a variation of the question. Yes, very good. I guess your name is Ritu or something like that. Reds. Chalo. So this again is a variation of the same question. Cementum is formed from the cells derived from or differentiated from. So which cells differentiate to form cementum? Options are papilla, follicle, organ, or stratum intermedium. Stratum intermedium is a part of enamel organ. So the option D itself rules out the option C, isn't it? It helps us rule out both these options. So option A and option B, dental follicle and papilla, and yes, SR, very good. It is dental follicle. So dental follicle cells would differentiate into cementoblasts, odontoblasts, and fibroblasts. So cementoblasts would form cementum, odontoblasts would form alveolar bone, and fibroblasts would form periodontal ligament, isn't it? Yes, 10th ka B. Very good, everyone. So let's go to the last question. Type of collagen found in bone and dentine. So which collagen is primarily found in bone and dentine? Now the question implies, or maybe when you read this question for the first time, you might think that it is just generally asking about the collagen fibers. But since we have all these different fibers and there is no other option which is grouping these fibers, we cannot assume that it is asking about all the fibers that are present. We have to assume that this question is implying about the primary fiber that is present in these hard tissues, isn't it? तो present तो कोई सा भी हो सकता है, type 1 भी होगा, type 3 भी होगा, type 4 भी होगा, है ना? और type 2 भी हो सकता है, trace amounts में type 3 भी होगा, जहाँ भी repair हो रही है वहाँ type 3 आता ही है, type 12 भी आता है. So there are variety of collagen fibers that are present in any tissue, isn't it? पर यहाँ पर तो ऐसा कुछ नहीं लिखा कि primary है या most common है या कुछ और word है, नहीं लिखा ना. But again options में भी ऐसा कुछ नहीं है कि हम एक या एक से ज्यादा फाइबर्स को चूज कर सकें. तो हमें यहाँ पर इस क्वेश्चन में खुद से ही ये सोचना पड़ेगा कि इट इज आस्किंग अबाउट द प्राइमरी फाइबर और द मेन फाइबर, isn't it? So the primary fiber of any hard tissue would be type 1, obviously except for enamel. Enamel does not have any collagen fiber, isn't it? enamel does not have any collagen fiber. अच्छा, that being said कि enamel does not have any collagen fiber. Are any collagen fibers associated with the formative cells of enamel? Are any collagen fibers associated with formative cells? That is ameloblasts, isn't it? This is a very direct question. So maybe you'll be able to answer it. Are any collagen fibers associated with the formative cells of enamel? A simple yes or no would do. होता है कि नहीं होते? हाँ या ना में बस बोलोगे तो भी चलेगा मेरे को. Are any Prachi, Ribs, SR, Nimisha, Aarti, are any collagen fibers associated with the formative cells of enamel? That is ameloblast of enamel or maybe the enamel organ. क्या वहां पर कहीं पर कोई कोलेजन फाइबर होता है enamel organ के अंदर या मे बी ameloblast के आसपास होता है क्या? Let me make this question more precise. Within the enamel organ, right? So instead of formative cells, let me say collagen fibers within the enamel organ. Are there any collagen fibers within the enamel organ? Within the enamel organ. और तुम में से कोई भी जवाब नहीं दे रहा, बहुत देर हो गई पूछते पूछते. नहीं तो शायद सब वेट कर रहे हैं कि सर ही आंसर कर दें, हमको ना गलत आंसर करना पड़े. गलत आंसर करना अच्छी बात होती है, पता है. क्लास के अंदर हमेशा कोशिश करनी चाहिए गलत आंसर करने की. Why? Because you'll get to learn more from a wrong answer than from a right one, isn't it? सही आंसर दे दिया तो टीचर के पास भी कुछ बताने को नहीं बचा. गलत आंसर दोगे तो हो सकता है टीचर भी 2 बात बताए एक्स्ट्रा, तो ज्यादा सीखने को मिलता है गलत आंसर देने पर, राइट? तो ट्राई टू आंसर इनकरेक्ट, ठीक है? ट्राई टू गिव इनकरेक्ट आंसर्स. तो जैसा कि तुम सबने किया, वेरी गुड. ऑल योर आंसर्स आर इनकरेक्ट. व्हेन यू से नो, योर आंसर्स आर इनकरेक्ट. टाइप 1 से लेकर के टाइप 3 तक, दैट इज टाइप 1, टाइप 2 and type 3, collagen are found in enamel organ. And which cell secretes these fibers? These fibers are secreted by stellate reticulum. So if someone asks you, is there any cell in the enamel organ that has a mesenchymal activity or that shows a mesenchymal activity, then you can say yes, there is a cell. And which cell is that? It is the stellate reticulum. So stellate reticulum cell, though of ectodermal origin, it has mesenchymal activity. And what is the activity? It produces type 1, 2 and type 3 collagen fibers. But these fibers are found only in enamel organ, not in the enamel. Is it clear? तो इसको कंफ्यूज मत करना कि इनामल में मिलता है कोलेजन. नहीं, इनामल में कोई कोलेजन नहीं है. इनामल के अंदर कोई भी कोलेजन नहीं है. ये कोलेजन केवल कहाँ है? इनामल ऑर्गन में. इज इट क्लियर? एंड दिस इज अ प्रूफ दैट द stellate reticulum cells, they show mesenchymal activity, right? तो गलत आंसर देने में घबराना नहीं चाहिए, उससे हमें कुछ एक्स्ट्रा सीखने को मिलता है हमेशा. सही आंसर देने से कभी कुछ एक्स्ट्रा सीखने को नहीं मिलेगा, राइट? सो टाइप 2 कोलेजन इज टिपिकली फाउंड इन, तो अ वेरिएशन ऑफ द क्वेश्चन दैट वी जस्ट solved, right? So there we solved that which collagen is primarily found in the heart tissues, and now the question is asking about type 2 collagen, right? Where is it specifically or typically found? Tell me, what is the fate of enamel organ? What is the fate of enamel organ? Since we don't have a lot of time, I'll tell it to you. What happens to enamel organ is that it slowly undergoes degeneration, isn't it? And it converts into reduced enamel epithelium. It reduces in size, it reduces in bulk, and later on it will fuse with the oral epithelium, isn't it? And it will provide attachment. So it translates into primary junctional epithelium or the primary attachment epithelium. Now there is no specific use for this collagen fibers, right? There is no specific use or significance for this collagen fiber. Maybe it provides strength or substance or shape to the enamel organ, but it has never been clearly mentioned in any text कि उसका क्या function होगा, क्या उसका fate होगा, या क्या उसका रोल है, इन सब के बारे में नहीं है. बट दिस इंफॉर्मेशन इज मोर और लेस फॉर द MCQ पर्पस, राइट? क्योंकि समटाइम्स दे विल आस्क यू कि which cell has a mesenchymal activity in the enamel organ or which are the collagen fibers that are present in the enamel organ. क्योंकि कई बार क्या होता है कि वो कुछ अलग सा क्वेश्चन पूछना चाहते हैं, तो मे बी that's why it is used. Apart from that, I haven't read about any specific role for these collagen fibers in the enamel organ. But as far as the fate of enamel organ is concerned, it fuses with the enamel, it fuses with the oral epithelium and it forms the primary junction epithelium, the first attachment epithelium, right? Rids, is it clear? तो कोलेजन का क्या रोल है अभी तक हमें पता नहीं है, और मे बी क्योंकि वो ऐसे टिश्यू के अंदर है जिसमें हमें फर्क भी नहीं पड़ रहा है, तो इसलिए शायद ज्यादा स्टडी भी नहीं किया गया है, राइट? बट वी कैन अज्यूम दैट मे बी इट इज प्रोवाइडिंग सम स्ट्रेंथ और मे बी शेप और मे बी सब्सटेंस टू द एनामल ऑर्गन, राइट? तो टाइप 2 कोलेजन इज टिपिकली फाउंड इन कार्टिलेज, बोन, डेंटिन एंड सीमेंटम. तो इसका आंसर क्या होगा? जैसा कि आरती ने और रिट्स ने हमें कहा है, इसका आंसर होगा कार्टिलेज. So very good. Yes, it is found in cartilage. Which type of collagen predominates in the pulp? Now we have talked about the hard tissues. Let's go to the soft tissue. So the only soft tissue of the tooth is pulp of the tooth, right? Inside the tooth. Not talking about the periodontium. So the only soft tissue in the tooth is pulp. So which type of collagen predominates in the pulp? Type A, type 1 and 3, type 2 and 4, 1 and 4. So the correct answer here would be option A, that is type 1 and type 3, and they are present in the ratio of 55 is to 45. So almost in the same amount, right? Almost in the same amount they are present in the pulp. No, Prachi, it is option A, that is type 1 and type 3. They are both present in pulp, isn't it? They are both present in pulp. Can you tell me which collagen fibril is found in the basement membrane? Which collagen fibril is found in the basement membrane? Which collagen fibril is found in the basement membrane? Is it type 1, type 2, type 3, 4, 5, 6, 7, 8, 9, 10, 11, 12? कौन सा होगा? का तो ये सही है. Which collagen fibril is found in the basement membrane, or to be more specific, is found in the basal lamina. Right? Which collagen fibril is found in the basal lamina, and the correct answer is type 4, isn't it? Type 4 सभी बच्चों ने सही बताया. and इसका कॉन्फ़िगरेशन कैसा होता है? Chicken wire, isn't it? It is arranged in chicken wire. Yes, very good, Rich. And everyone else, it is chicken wire. हाँ ना, बिल्कुल सही है. Is there any other collagen fibril associated with the type 4 in the basement membrane? Now there is a difference between basal lamina and basement membrane, isn't it? Basal lamina and basal lamina basically consists of lamina lucida, lamina densa, isn't it? This is an electron microscopic structure. Basal lamina is electron microscopic structure, and basement membrane is seen on light microscope. So basically basement membrane consists of basal lamina plus the cell-free zone of the connective tissue, isn't it? So that's why I asked about the basal lamina specifically here, because talking about basement membrane includes a lot many other fibers apart from type 4 as well, isn't it? So when you say basement membrane, it includes basal lamina plus cell free region of the connective tissue, isn't it? So basement membrane has more collagen fibrils apart from the type 4, isn't it? So apart from the type 4 there are other collagen fibrils as well. Which are those? Type 1 भी होगा, type 3 भी होगा, type 7 भी होगा. So which of these do you think is the anchoring fibril? So which of these is the anchoring fibril? Which of these is the anchoring fibril? थोड़ा टाइम है हमारे पास. Which of these is the anchoring fibril? मुझे लगा था कि टाइम कम होगा, but we have sufficient time. Yes, very good. Type 7 is the anchoring fibril. So when you say basement membrane, we have 4 different types of collagen associated, isn't it? And when we say basal lamina, then it is only type 4 collagen, right? Ajab, I have told you about basal lamina, I have told you about basement membrane, maybe in brief. I am going to ask you a question now based on this. So not from the questions that we have discussed, but from what we have just discussed. Or let me rephrase it. Basement membrane consists of, maybe basement membrane contains whatever, right? Or basement membrane shows. So hemidesmosomes, lamina lucida, type 12 collagen. क्योंकि मुझे और कुछ समझ नहीं आ रहा था, इसलिए मैंने ऑप्शन सी दे दिया. So maybe we can rule it out. And option D is both A and B. तो क्या लगता है क्या आंसर होगा? So obviously we can rule out this option C. ये फालतू के क्वेश्चन ऑप्शंस को हम इग्नोर ही कर देते हैं. So basement membrane consists of hemidesmosomes, lamina lucida, both A and B. Which of these 3 do you think is the correct answer? Now let me tell you what hemidesmosomes is before you answer this question. Let's say this is the basal cell, right? This is the stratum basal. So this is the basal cell. Let's say this is the basement membrane, right? And the attachment of this basement membrane to this basal cell is via hemidesmosomes. It is via this hemidesmosome. So basement membrane basically includes this hemidesmosome, the basement membrane, and the connective and the cell-free zone, right? The cell-free zone. All these 3 they form the part of basement membrane. Is it clear? Basal lamina, the hemidesmosome, and the cell-free zone. They all of these 3 they form the part of basement membrane. तो हेमिडेस्मोसोम होगा, लमाइना लूसिडा होगा, या ऑप्शन डी दैट इज बोथ ए एंड बी. क्या होगा? बेसमेंट मेम्ब्रेन कंसिस्ट ऑफ, और बेसमेंट मेम्ब्रेन शोज, और बेसमेंट मेम्ब्रेन कंटेन्स, और व्हिच फॉर्म्स अ पार्ट ऑफ बेसमेंट मेम्ब्रेन. अब ये फिलॉसफी वाला क्वेश्चन है, ठीक है ना? मतलब है तो डेंटिस्ट्री का ही, बट इसको सॉल्व फिलॉसफी के हिसाब से करेंगे अपन कि भाई ऐसे हम देखें तो लमाइना लूसिडा इज अ पार्ट ऑफ बेसल लमाइना एंड बेसल लमाइना इज अ पार्ट ऑफ बेसमेंट मेम्ब्रेन, isn't it? So logically lamina lucida should be part of basement membrane, but lamina lucida is not a part of basement membrane. It is the part of basal lamina, and basal lamina is the part of basement membrane. समझ में आ रहा है? क्या तुम्हें समझ में आ रहा है? Lamina lucida is a part of basal lamina, not of basement membrane. Basal lamina is a part of basement membrane. Lamina lucida and lamina densa, they form basal lamina. They do not form basement membrane. And the basal lamina, along with the cell-free zone and the hemidesmosomes, forms the basement membrane. Is this making some sense to you? क्या ये चीज कुछ सेंस बना रही है आपके दिमाग में? Lamina lucida is a part of basal lamina, and basal lamina is a part of basement membrane. Is it clear? Sometimes we will ask what is the smallest structural and functional unit of enamel, and maybe in the options you will have enamel rod and hydroxyapatite crystal, right? Maybe if I want to confuse you, I'll give you both or either, isn't it? So when you have such a question, which of these two would you choose? Rod or hydroxyapatite crystal, or would you choose either or maybe both? Which of these would you choose? Again, in these questions, we'll go with enamel rod, because numerous enamel rods will form the enamel, and yet if we are asked which is the smallest structural and functional unit of enamel rod, then the enamel rods are made up of hydroxyapatite crystals, isn't it? So several hydroxyapatite crystals will form one rod, and several such rods will form enamel, isn't it? तो हम ऐसा क्यों करते हैं कि enamel का smallest structural and functional unit हम hydroxyapatite को तो नहीं बोलते, हम enamel rod को बोलते हैं, right? Because that is the repeating structure, isn't it? तो वो उसके अंदर repeating structure, enamel rod का जब composition की बात करते हैं उसके अंदर hydroxyapatite है। तो जब भी आप इस तरीके के क्वेश्चंस को सॉल्व करते हो, always look for the immediate step. enamel है तो उसका immediate step enamel rod है, enamel rod के बाद hydroxyapatite है। बेसल मेम्ब्रेन है तो बेसल मेम्ब्रेन के बाद immediate step बेसल लमाइना है, बेसल लमाइना के बाद लमाइना लूसिडा या डेंसा है, राइट? तो हमेशा जो immediate step है उस पे ही देखेंगे, हम नेक्स्ट स्टेप पे नहीं जाएंगे। क्या ये बात समझ में आ रही है? Is this point clear? तो जिन भी बच्चों ने यहां पर ऑप्शन डी को मार्क किया था वो सही है या गलत है? मतलब ठीक है, इमोशनली तो सही है कि सब कुछ है तो उसके अंदर ही, बट मार्क्स नहीं मिलेंगे, है ना? मार्क्स कब मिलेंगे? जब हम हेमिडेस्मोसोम को मार्क करेंगे, ठीक है? समझ में आ गया बच्चों? Is there anything else that you would like to ask? Now, I had a query in the last session. Someone asked me about the dentition, right? Classification of dentition. उसमें भी ड्रायोपैथिकस पैटर्न पूछा था, ड्रायोपैथिकस पैटर्न। तो ड्रायोपैथिकस पैटर्न क्या होता है? लास्ट क्लास में किसी ने मुझसे पूछा था ड्रायोपैथिकस पैटर्न। तो बेसिकली ड्रायोपैथिकस पैटर्न क्या है कि जिसमें आपका मोलर, उसके अंदर कस्प्स इस तरीके से अरेंज्ड हैं कि वहां पर एक वाई शेप्ड सेंट्रल ग्रूव बन रहा है। द सेंट्रल ग्रूव, the central groove is Y shaped and it has 5 cusps, isn't it? So ड्रायोपैथिकस pattern means it is a molar which has 5 cusps and there is a central groove which has a Y shaped pattern, right? Apart from that, अगर हम और classification पे जाएंगे, किस तरीके से हम dentition को classify कर सकते हैं, तो we can classify based on the different types of teeth present in the same dentition, number of sets, monophyodont, diphyodont, polyphyodont, right? Then we can classify it based on the shape of the cusp, and ड्रायोपैथिकस again is the shape of the cusp, be it molar or maybe you can say the occlusal anatomy. So I'll just tell you about it quickly, right? So based on the type of teeth, that is heterodont or homodont. Heterodont means different sets of teeth. हेट्रो मीन्स कनाइन भी है, इंसाइजर भी है, प्रीमोलर भी है और मोलर भी है। कनाइन पहले लिख दिया मैंने इंसाइजर से, तो है तो सारी, isn't it? So we have all these 4 different types of teeth. So human dentition is heterodont. Homodont means same teeth, जैसे मगरमच्छ में होते हैं, right? Maybe in the fish, but definitely not in human beings. Clear? So we have heterodont, not homodont. Homodont means same type of teeth. All the teeth, they look similar. Then based on the number of sets of dentition, isn't it? Monophyodont means there is just a single set of dentition throughout your life. Diphyodont means there is a primary set and then there is a permanent set. Polyphyodont, just like in sharks, there are n number of sets. They will continuously keep on replacing, right? The teeth continuously keep on replacing. So diphyodont, this is seen in human beings, right? We have a primary and a permanent set of dentition, right? Monophyodont, that is there is only one set, and polyphyodont, there are multiple sets. Clear? So human beings के अंदर diphyodont, based on their attachment to the jaw. So thecodont, acrodont or pleurodont. अब let's say this is the alveolar bone, right? This is the alveolar bone. In case of pleurodont, what will happen is the tooth will be attached to the side. The tooth will be attached to the side of the bone. This is a pleurodont, right? This is a pleurodont. In case of acrodont, let's say again, this is the alveolar bone, and in acrodont there is no root and the crown is attached directly over the alveolar bone. What is thecodont? Theca means sheet. So theca basically implies the presence of periodontal ligament, and in human beings the tooth is present within the bone, the root is embedded in the bone, and there is a layer of periodontal ligament surrounding it. So when you say thecodont, the theca, that is a layer, it implies periodontal ligament, isn't it? So in human beings we have thecodont. The human beings, the dentition can be classified as thecodont. By cusp form, so based on the shape of the cusp, buenodont, lophodont and selenodont. So human beings have buenodont, that is their cusps are low and that is their crowns are low and the cusps are rounded. So buenodont means rounded cusps, right? As in human beings. So cusps are rounded. In case of lophodont, in lophodont there will be presence of ridge. So on the occlusal surface of these teeth you will see ridges, and in selenodont you will see crescent shape. So the cusps will be like this, crescent shape, isn't it? The cusps will be like this, crescent shape. So we need not worry about this selenodont or lophodont. In human beings we have buenodont. There is one other terminology used, haplodont. Haplodont के अंदर जो word haplo है, haplo means single, right? It means single. So basically haplodont implies a tooth with single conical cusp, right? So we can use the term haplodont for canines, right? We can use the term haplodont for canines because they have a single conical cusp, right? तो हैप्लोडॉन्ट को भी आप याद रख सकते हो. मोलर पैटर्न के ऊपर बेस्ड ड्रायोपैथिकस एंड बाइलोफोडॉन्ट. तो ड्रायोपैथिकस हमने अभी भी डिस्कस किया इन द बिगिनिंग ऑफ दिस डिस्कशन कि इट हैज अ वाई शेप्ड सेंट्रल ग्रूव एंड इट हैज 5 cusps, right? So examples are human beings and apes. Bailophodont, what is bailophodont? It has 2 transverse ridges. Right? So not just 2 transverse ridges but 2 prominent transverse ridges. So on the occlusal surface of such teeth we'll have prominent transverse ridges, right? So we don't have such prominent transverse ridges, but in the teeth that are classified as bailophodont, they'll have prominent transverse ridges on their occlusal surface. Is it clear? तो ह्यूमन डेंटिशन को हम कैसे क्लासीफाई कर सकते हैं? बेस्ड ऑन द नंबर ऑफ सेट्स, डाइफाइडोंट, बेस्ड ऑन द टाइप ऑफ टीथ, हेटेरोडोंट, based on the attachment, thecodont, right? Based on the shape of the cusps, unodont. Haplodont can be used specifically for canines, and by the shape of molars, we can say that they follow the Dryopithecus pattern, right? Is there anything else that you want to ask? Is there anything else that you would like to ask? क्या आपको कुछ और पूछना है? ये आपका आगे का शेड्यूल है. आज हमारा DADH का डिस्कशन हुआ है. Tomorrow you'll have prosthodontics then on 15th, pedo, endocons on 16th, oral surgery 17th, and so on. So is there anything that you would like to ask? Acrodont, example acrodont का may be frog or other amphibian species where there is just a crown, there is no root, right? Acro means crown, ठीक है? So there is only a crown and there is no root, and this crown form is attached to the surface of the alveolar ridge, right? तो जैसा कि हमने ड्रॉ किया था, let's say this is the alveolar ridge, right? And on the alveolar ridge, this crown is attached like this. Pleurodont के अंदर हमने क्या कहा था? Let's say this is the alveolar ridge, and on the side of the ridge, right? On the side of the ridge, this tooth is attached. So the tooth is attached to the side of the ridge in pleurodont. And on the top of it is attached in the acrodont. Anything else? अगर और कुछ नहीं पूछना है तो फिर ऑल द बेस्ट. खूब सारे MCQ सॉल्व करो, ठीक है? Keep on practicing. Solve as many MCQs as you can, and if you have any doubt, reach out to me, right? So good night.